And in this video we're going to look at some of the CT features of acute appendicitis. And we're going to do it by looking at axial and coronal images from a case of a 60-year-old male presenting with right-sided abdominal pain. We're going to begin by looking at the coronal images. And you can see here in the right iliac fossa that there is a blind-ending tubular structure. And as we follow it back, we can see that it arises from the base of the caecum, consistent with it being the appendix. When we switch to the axial plane, we can see that the appendix is abnormally distended, measuring greater than 6 mm in diameter, and the fat surrounding the appendix is abnormal. Instead of appearing nice and black, the fat is edematous and has turned grey, an appearance known as fat stranding. We can compare that to a region of normal intra-abdominal fat here, which has a nice black appearance. We can also see that there is a linear structure coming off the appendix, which is an inflamed meso-appendix, which is often seen in the setting of appendicitis. This patient also has reactive enlargement of their mesenteric lymph nodes, which is another common finding in acute appendicitis. Importantly, our patient does not have evidence of an abscess or any locules of free gas to suggest perforation. Here's a different patient showing an abscess adjacent to the tip of an inflamed appendix. This patient also has a calcified appendicolith at the base of the appendix, causing the obstruction. This is a common finding in appendicitis, but is certainly not present in every case. This patient also has an unrelated but very important pathology demonstrated on these images. Here in the left renal upper pole there is a heterogeneous mass which is quite large and is invading beyond Gerota's fascia and probably getting into the left adrenal gland. This appearance is consistent with a renal cell carcinoma, which was an incidental finding in this patient, but obviously a very important one. So there you have it, some CT features of acute appendicitis, blind-ending tubular structure in the right iliac fossa arising from the base of the caecum, with thickening greater than 6 mm and surrounding inflammatory fat change.